Hi there, I'm Dr. Ashley Curtis with the Griffin Center for Hair Restoration. Today I'd like to talk a little bit about the hair transplant procedure, some of the common questions that we get regarding the actual procedure, preparing for the procedure, and the recovery time. The most common question we get is, what can I do to prepare for this procedure? What special things do I need to do as the patient? Well, in reality, there's not a whole lot that you need to do. We try to make this a very easy, smooth procedure for you. One thing we do ask is that you do not cut your hair about a week or two before the procedure, at least. We prefer that it actually is a little longer than you normally wear it. In addition, we really recommend that you've already started some sort of preventative program as far as hair loss prevention in the form of either topical medicines or oral medicines before the procedure. That's extremely important in maintaining the great results that you get. Another question that we get is, how long will I be here? What's going to go on the day of the hair transplant procedure? Normally the hair transplant procedure will last anywhere from 4 to even 6 or 7 hours. It depends on how many grafts you're getting, but you are the one case of the day. Our entire attention is focused on you, and we do our best to make this a very easy, painless, smooth procedure for you. So another question is, what is different about our procedure here at the Griffin Center compared to other places you could get a hair transplant at? Well, there are a lot of differences here. Number one, like I mentioned, you're the only case of the day. All of our focus is on you. The physician is involved in the case from the start to the finish, and there's a very big aesthetic component to this. So the physician is the one that's responsible for that. So here at the Griffin Center, we take full responsibility for that. Our trained staff has been here for many years and are very consistent. So they know what we like, what would look best for you, and they've been working with us for a very long time, perfecting the techniques in hair transplants. In addition, we at the Griffin Center feel it's very important that we have a very good relationship with our patients. So we're here for you before the procedure, during the procedure, and after the procedure. Some questions about the recovery period. What will it be like? Will my activities be limited? The procedure is not one that requires a whole lot of downtime. Your activities should not be limited for very long at all. Some patients do have a little bit of redness in the area for a couple of days afterwards, but that is also temporary. You can resume normal activities very soon after the hair transplant. Some of the things that we get questions on are hair styling and techniques on how to maintain the recovery and things like that. We do ask that you not wash your hair the day of the procedure. We will actually wash it for you the day after, and then thereafter give you techniques on how to wash your hair gently and what shampoos to use. You can go ahead and start cutting your hair and styling it shortly after, within a week to 2 weeks after. If you do use color or perming, we do ask you wait about a month. But otherwise, you can really resume normal hair styling shortly after the procedure. Let's see, when will my new hair start to grow after my hair transplant? This is the exciting part. Well, normally we see new hair growth around 3 to 4 months. Everybody's a little bit different, but for the most part, it's around 3 months. Full regrowth can take anywhere from a year or so to see. We 100% want to see a photographable difference that you are pleased with after your transplant procedure. So we do take photos before and after, sit with you, discuss the results, and see how you're doing. If you have any further questions regarding the transplant procedure, what to expect, recovery period, please feel free to give us a call here at the Griffin Center. Thanks so much.